Mrs. Valdez. Nice to meet you. My name is Mariette. How are you?
Fine, thank you. And you?
Yes, I'm very fine, thank you. Can you maybe tell me something about yourself?
Okay, my name is Marieke Valdez-Waite. I'm Dutch, but I'm married to a Peruvian man. I'm an English teacher, but I studied theology, and at the moment I'm working as an English teacher.
Okay.
I lived in Peru for 10 years, so
That's
more or less my background. Yeah.
It's quite some time.
Yeah, a little longer than we originally expected. We said at the beginning, okay, 2 years, so my husband could finish his studies.
Okay.
But 2 became 4, 6, and at the end 10. So, yeah. Once you're settled, it's not that easy to go back. Yeah.
No, I understand.
Yeah.
You have family there and friends.
Yes, and when you start working, and yeah.
Yeah. Okay. Now, is it okay if I tell you something about the interview?
Yes, of course.
I'm doing this interview for an assignment from school, where we have to interview someone who is recently settled in the Netherlands for less than 5 years now. The interview will be about the cultural differences in healthcare, disease perception and perception on healthcare profession. So those are the 3 main topics I'm going to ask questions about. It will take around 25 to 30 minutes.
Okay.
That's okay?
Yeah, that's okay.
And if anything is unclear about what I say in English, or if you don't understand, you can say it and I will try to put it in other words.
Okay, that's fine.
I also will use this interview for an assignment from school. That's okay?
Yeah, don't worry, that's
Yes?
okay.
Thank you. Can you maybe tell me something about Peru?
Like in general, just or specifically about healthcare?
A little bit about in general.
Okay, Peru is quite a big country in South America. It's situated between Ecuador and Chile. If you compare it to Holland, it's like much bigger. I think it's 37 times bigger. So, but the population is not even double the population. No, it is. No, they have somewhere in the 30 million, 35 million people, I think. But the main part of the population is situated in the coast, where you can find the biggest cities like the capital Lima.
Okay.
And they have 3 main regions. You have the coast, which is mostly more densely populated, but also more industrialized. Then you have the mountain area, the Andes, and the jungle. Okay. And that's quite important because the climates are different, but also the economical, for example, socio-economical situations are completely different. Healthcare is very different. So, yeah.
From which region?
We lived in Lima, the capital, mainly because of work.
Okay.
It's because, for example, Peru is a very nice country to travel through because it's really nice. But Lima is not that nice. It's enormous. It's like it has almost, there are different estimates, but more around 8 million people just in the city itself.
So that's almost
it's crowded. Yeah, and it's very polluted, so it's quite dirty and quite dangerous as well. So that's not the but okay, if you want to have a good job, you should live in Lima. So
so that's why you live there.
Yeah, that's why we live there.
Okay. Yeah. And is the culture in Peru very different from the culture in the Netherlands?
Yes, there are big differences, but on the other hand, if you live, for example, in a city like Lima, it doesn't feel that different because it's quite industrialized. So you have supermarkets and, for example, malls and so on, banks. But the differences between rich and poor are quite big as well. So it depends a lot on where you live. But in general, they're very friendly and like warm-hearted. But on the other hand, they're also quite old-fashioned in some aspects. So yeah.
Okay, it's nice to hear. Is it okay if I start with the first topic?
Yes, of course.
This is cultural differences in healthcare. Can you tell me something about the healthcare in Peru?
Now, healthcare in Peru is quite a complicated topic because you have a lot of different like groups to call them. You have the main part, I think is like more than 50% of the population. If they want to get healthcare, they have to go to one of the hospitales del pueblo, which are like local hospitals, which are quite cheap if you talk about the attendance, but you have to pay the medicine themselves, and which some people can't afford. And then you have, I think it's a 30%, which is salud, that's paid by people that have by the companies for people that have a job. That's still not really good. So it's like, for example, when I was pregnant, I could go to salud, but I decided to go to a private clinic because healthcare is better.
Yes.
But it's quite expensive. So in salud you get everything paid, but it's because you have a job. If you don't have a job and you don't have that insurance, you can go there. Yeah, and there is a small part for militaries and police officers, which have their own hospitals, and then you have maybe 10%, but I don't think it's even 10% for the private sector, which is quite expensive. Yeah. And then you have special insurances, but they don't cover everything, and that's very expensive. Yeah.
Okay. And that private clinic, is that?
Yeah, they're clinics, and most of the time they're quite expensive. Of course, there are also a lot of degrees in the clinics, like you have the extremely expensive and some quite expensive clinics. Yes. And they have their own insurances. But for example, if you have a basic insurance, you pay quite a lot of amount, but it doesn't cover cancer or other diseases, so you have to have extra insurances for those diseases.
Yes.
Which makes it more.
So it's very expensive.
That's very expensive, yeah. But most of the time, if you don't have money, then it's very hard because you don't get the help you need. Even in the local hospitals, you don't.
Okay.
And if somebody's sick, for example, and they need, for example, blood transfusions, they have to ask family members to go to the hospital to donate blood. If not, they won't get it. Yeah.
Okay, that's different.
That's very
than
hard.
The Netherlands.
Yeah.
Yes.
And for example, the good thing of the Netherlands is that you have quite a level of safety or security. You know that if you have an insurance, you don't have to worry about, for example, the health of your children or whatever. But there you always do, because you never know how much you have to pay.
So not many people have insurance. I
had, for example, insurance for my work, but then you have to accept another level of attendance and another level of privacy, and you have to pay some things yourself. And if you have another insurance, then it covers never 100%. It always covers, for example, 80% of the expenses. But if you have, I know, for example, you have to have surgery, for example, brain surgery or whatever, which is very expensive. And you have to pay 20% of the total amount.
It's still a lot.
It's still a lot.
Yes. And for children?
The same. Yeah, that's exactly the same.
Okay, so also not that they can go to the doctor anytime and...
No, you have to pay for that. And of course, for example, what I said, there are some local posts or whatever where you can go and you only pay, for example, 1 sol, which is like 25€, which is nothing for us. Okay, that's only in attendance, and then they tell you that you have to buy, for example, medicine or whatever. And for some people, they have only money for their daily food, and that's it. So even 1 sol is quite a lot.
Yeah, they don't have money
to buy medicine or whatever. Yeah.
Okay.
And there are some programs, of course. For example, ONGs or other international organizations that offer free care.
Yes.
But that doesn't always supply all the needs. So.
It doesn't cover all the... No. Okay. And is it harder to use the healthcare in Peru when you are from a poorer family?
Yeah, because you don't have the means to pay. So of course you can only go to some kind of hospital, or not clinic, but hospital or medical post. And then the problem is that most of the time they have to wait a lot. Or if you talk about the rural areas, for example in the Andes or in the jungle, even there the medical posts don't have the supply, so they don't have the medicine or they don't have the vaccines. So they go there, but there is no medicine. So they have to go to a pharmacy, and sometimes they have no money for that. So.
Yes.
And in the inland, so in the Andes and the jungle, there's also a lot of corruption. So sometimes there is money sent or medicine sent to those posts and it disappears, or they start selling it. Yeah.
Yes. So it doesn't come to the
people that really need it.
Yes.
Yeah.
Okay. It's different from than the Netherlands.
Yeah.
Do you have to travel a lot to get to a doctor or to a hospital?
Sometimes, if you live in Lima, most of the time not that far, and you can take a bus to go to one of the hospitals. But if you live in the Andes, most of the time they have to walk. Like the children sometimes have to walk to school for 2 hours. The same if they have to go to a doctor or whatever, they have to walk for hours.
Yes.
Yeah. So that's another.
Yeah. So you don't go to the doctor in like 5 minutes. You really
As in the bigger cities you can, but not in the little towns or in the jungle or whatever. No.
Yes. Okay. Is there a difference in healthcare when you're from a rural area or an urban area?
Yeah, as I said, if you live in a rural area, then distances are longer. The medical posts are usually not that well supplied, so they miss a lot. I think, but I'm not really sure, but I think that doctors are kind of obliged to go to a rural area when they start working for 1 year or so. But still then, if you really want to have good attention, you have to go to one of the hospitals, which are never in the little towns, so then they have to travel a lot.
Yes. Do the people in the rural area also have less money?
Yeah, most of the time they do. Yeah.
Okay.
Not always, because if you are in the Andes and you live, there are people that have money, but most of the time if you live in one of those little villages, the housing is very poor, they have no heating, they have most of the time no beds or no stove, they just cook on wood or they sleep on some straw on the ground, so yeah. Yes. And if it's, the problem is when, for example, the Andes is very high, so almost every winter in Lima, for example, they collect money or blankets or whatever to send to the Andes, because it gets very cold and children die because of just the flu or, for example, pneumonia, because they don't get the help they need.
And they support each other by collecting.
Yeah, but every year it's the same, because every year they say it's too cold, so cold, so they try to help, but they don't start where they should start, so there is no basic help, so you can start sending things, but it's more like trying to find the outcome of what's not working well, so I'm not sure if that's the solution.
The problem doesn't disappear.
No, it's every year the same.
Okay. Well, I get a good overview about cultural differences in healthcare.
Yeah.
Is it okay if I ask some questions about disease perception?
Yes, of course.
What view do people in Peru have on having a disease? Do they go to the doctor very soon, or?
Yeah, actually you do. For example, if somebody is feeling not so well. For example, I have children, and when my children were little, sometimes it was difficult for me, because when they were sneezing a little bit or coughing, it was like my family-in-law usually said, you have to call the doctor because he's got the flu. They know he sneezed once or twice. Let's wait. And the same as I remember that once I got to work, or one of my colleagues said, they said something like, in Spanish they say, está volando en fiebre, which means like he's flying in fever, which means his fever is very high. And when I asked, okay, what happened, what is his temperature, he said 38 point something, which is not too high according to our perception.
Yes.
So they automatically run to the doctor for everything they have. if they can. And then I talk about people that can pay for it, of course,
Okay.
because if not,
Yes.
they won't.
But even though it's expensive, they still.
Yeah, they go quite quickly, and when you go, you always get a lot of medicine. That's something else. Like in Holland, we try to wait if you have, because that's one of the things that I think is not really right over there. If you go to just a normal drugstore,
Yes.
which we call here just something like Kruidvat, you can also buy medicine which you officially need to just on a with a doctor receipt. You have
Oh,
to.
yes.
You can just buy it. It's officially illegal, but people say, "Oh, I have sore throat," and they go to get some pills.
And it
Yeah.
happens. They can
Yeah.
get it in a drugstore.
Yeah, and the other problem is that if you fail from work too often, you don't get paid. So I remember the first years I worked there. If you miss a day, they don't pay you. If you miss a week, they
Okay.
won't pay you. So people more easily go to the doctor because they have to get well soon.
Yeah. They have to
And sometimes you
prevent,
get paid, but they don't want you to be sick too often. So
Okay.
yeah,
Yes.
that's another difficulty.
Yes. That's also different than here.
Yeah, but also doctors give more medicine than they usually do in Holland.
Do you know why?
I don't know. One of the reasons I think is, but then I'm talking more about the clinics, is that they usually get they try to make you buy the medicine in the clinic, which is more expensive, and they
Okay.
get money from it. And somehow it's also in the culture. I don't know why in Holland we tend to wait and to see if it's necessary.
Yes.
So if you have fever and you don't feel you feel okay, or when the children are playing but they have a fever, we don't give anything. But there's
No.
no, they have fever. We have to give them something because you never
Okay.
know what can happen. So it's a, I don't know, kind of fear.
Yeah. Okay. It's nice to know that. To find something out about the culture.
Yeah, it's old.
Yeah. Do people in Peru talk about their own health?
Like, how do you mean exactly? Like,
Now, like when you're feeling sick, do you talk about it, or when you're with family, do you talk about how you feel, or is that being ignored?
no, yes, they do. They sometimes like even give you too many details of they speak. Depends maybe also on the family, but most of the time in the family they tell everything that happens, and they go to the doctor and they will tell you the whole story about everything the doctor said. And yeah, and it sounds always somehow more dramatical than here, but also because they use more the scientific names, and we just say, okay, I've got a flu, or I have a cough, and they have like pharyngitis or whatever. It's more to like to the Latin words,
Yes.
which makes it sound like whoa, and they say, oh, sore throat. Okay.
It makes
Or
it sound like something horrible.
yeah, but yeah.
Yes. Okay. And when someone has a disease like cancer, do they talk about it also? Or
Cancer, yes, they do. But for example, things like HIV or whatever, that is more difficult. Or when you have TB or whatever, which also happens over there. Depends a little bit on the disease.
Okay.
But AIDS and HIV is still like something that's difficult to talk about. And
Yeah, people don't talk about it.
no, and even if they know people who have, for example, one of a contagious disease, people could ignore you. Yeah.
Okay.
And it depends also a little bit on the level of education.
How so?
People with most of the time, like with lower levels of education or in the poorer areas, they tend to have not too much knowledge about certain diseases, and then
Yes.
they draw their own conclusions and think it's dangerous and that they could catch it or whatever, and then
Okay.
they ignore people. Yeah.
Without them knowing that it's not, that
Yeah.
they can't catch it.
Yes.
Okay. Is there anything you'd like to add about the disease perception in Peru?
No, as you said, the first thing that came to my mind was just people, in my perception, run quite quickly to the doctors,
Yes.
and like they always want to get something like medicine, whatever, because if you go to a doctor, you don't get anything. It's like they haven't helped you.
It was useless to go.
Yeah.
there.
So that's always old. Yeah.
Okay, yeah, here is like, if you get an advice, it's already good because you know you can do something about it. But
Yeah, sometimes you just have to wait till it's over.
Yeah.
If it's a virus, it's a virus, because that's something else. They have some things like superstition, like if you have the flu, you cannot drink anything cold or hot,
okay.
and there are a lot of those things. And I remember when I was pregnant and I was sneezing a little bit. I had a little cold that I wanted to buy some ice cream somewhere. They didn't even want to sell me an ice cream
Oh,
because
okay.
that was not those things. Yeah.
So
Yes.
other people
Yeah, but even doctors, they have their own. Yeah, I would call it superstition. Not always, but okay. For example, but cold drinks and hot drinks, and there are a lot of others. Like you cannot drink coffee when you're pregnant, and you cannot do this, and you cannot do that. There are a lot.
so they don't allow you when you're pregnant to buy coffee in the store.
That's not today. They will probably. But I remember at my work, even my students said, "Miss, are you drinking coffee? You can't."
Okay.
Yeah.
Okay.
So yeah. For me, it's superstition. Some of them, and
Yeah.
coffee, I think, is just a little old-fashioned. But okay.
And there it's normal to.
Yeah, but they have other things that we don't drink or eat. That they say, "Huh? Yes, yeah." And I say, "Really, please, on the internet, you can find articles about it." But yeah.
Okay. Is it okay if I move along to the next topic?
Yes, of course.
That's perception on healthcare professionals. In Peru, do people respect health professionals and their knowledge, or?
Yes, they do. Everything the doctor says is just true. Although sometimes they go and ask for a second opinion, they do. And but again, there are big differences between like the hospitals and the clinics. When you go to a clinic, they can easily tell you what they told you in one of the local hospitals.
Okay.
No, it's not true or whatever. But if not doctors, yes. But there are a lot of technical, like we call them just nurses, but they have like technical assistants. There are different levels, like what
Okay.
we call them verzorgende and so on. They have also those levels, and like they respect the doctors, but nurses and so on, not always.
Okay.
The way they treat them, and
They don't always believe what they say or do what they.
yeah, or for example, when you are in a hospital because you're sick, they respect everything the doctor says, but if a nurse or whatever says something, they won't automatically believe what they say.
Okay.
It has to do with like if you have a university degree, a bachelor degree or higher, you count.
Okay.
And if not,
Yes.
not that much. So
Okay. And
yeah.
before people go see a doctor about something, do they also do a research on the internet about what kind of disease they can have?
Today more than they used to do, of course. It happens more. But they also have still a lot of like, they believe in the traditional or medicinal, how do you call that? I don't know the word. But okay, for example, if you go to the jungle, whatever, they don't always go to the doctor. They sometimes go to a medicine man, or they
Yes.
believe in some natural medicine as well, like a lot of leaves and some herbs and whatever that can help you.
That way
Yeah.
of curing,
They use that a lot still. Yeah.
Also in the city, or mostly in the jungle?
They do in the city, but most of the time, if they do in the city, and then you talk about like they always talk about A, B, C, D. The A, B are the higher economical social sectors.
Okay. Yes.
They do only when it's like actually really proven. But the poorer people, they use still a lot of that. It's also because they need to, probably because they can afford
A real doctor, so we
a
don't
real
see-
doctor.
Yes. Okay.
And somehow, I think some of them really work. If we talk about like the natural medicine,
Okay.
but not for everything, of course. Yeah.
Yeah, for some things you really need a doctor instead
Yeah.
of a clinician. Okay. Yes. Is there anything you'd like to add to this?
No, I think like what exactly? Not really. I think.
Okay. Then I'm done with the questions for this interview.
Okay.
Thank you so much for helping me out with this
You're
interview.
welcome.
And,
I hope it has helped a little.
very much actually.
Yes.
I found it very interesting to find something out about food.
Yeah, it's so different. I always when I lived there, the thing that worried me most was when I, for example, was pregnant. Like you really hope, of course, your children to be born healthy. But somehow there, it still worried me a little because if something happens, because I gave birth in a clinic,
Yeah.
we have to probably move to one of the local hospitals because you can never afford like
Yes.
bigger surgeries or whatever in one of those clinics. So
Okay.
when they're really healthy, you're like not just happy because they're healthy, because you're not worried anymore about if not, how can I ever pay for everything we need to pay for. So
Yes. Okay.
you never have that feeling over here.
You always know if there's something wrong, you will get help because
Yeah, and there every time you go, you always know I have to pay, even if my kids have asthma. And I remember when my son was little, we had to go to the hospital quite a lot to get him or medicine or to nebulize, and I don't know you call it vernebelen in Dutch.
Okay.
But every time you go, you have to pay. Yeah,
Yeah.
it's odd.
Yeah.
But okay, you are used to it as well. So.
Yeah, but you don't have the feeling here if you really don't.
No, you
feel-
have to go. We have to go again, but that's it because children just don't pay.
Yes.
You never pay for.
Yeah, that's something good about the healthcare in the
Yeah,
Netherlands. I think.
that's very nice.
Okay. Well, thank you again for this interview. And
Okay, you're welcome.